But what is life like for those people on the front lines fighting this virus? Well, Ed is joining us live from his home in Buffalo, taking us inside the ICU this morning. Good morning, Ed.
Hi, Katie. Good morning to you. For days now, the governor has said the worst of the COVID-19 crisis is behind us. But in Western New York, the reality is the war against this invisible enemy is far from over. New this morning, we're taking you behind the curtain into the controlled chaos of the ICU, giving you a firsthand look at the brutality of this virus and the people fighting on the front lines.
Intensive care, this is Lindsay.
Inside the ICU at Millard Fillmore Suburban Hospital.
Generally, the patients that come here are your sickest in the hospital.
Next door, 18.
In a moment of urgency, frontline workers quickly take off their protective gear, moving from one room to another, both with COVID patients. Alarms are ringing, monitors are flashing.
You have to rush in the room and do whatever you can.
When these nurses get in there with a new gown and gloves, the patient is stabilized in seconds. Lindsay Acevedo is the nurse in charge of the ICU.
In here, you don't know when a patient is going to get worse. Their condition changes so rapidly, and having to put on all of the PPE, you want to do it as fast as you can, so that makes you nervous. So everything that you do has a level of intensity.
Nothing like this was ever even in our imagination.
Registered nurse Julie Grimm is in the glass room next door, working on a new COVID patient just admitted from the ER.
She's critically ill. 1, 2, 3. Even though the emergency department has done a great job at keeping her in a decent place in order to transfer her here, there's still going to be a lot of work to be done.
This is not a drill. This is real life. And all of this before noon on Wednesday, 7 hours before their shift ends.
We're trying to wake her up? Okay.
These are the people on the battlefield in this fight against COVID-19. During morning rounds, they stop outside each patient's room, discussing their case and care. Doors are shut tight, there is tape over the windows, calling extra attention to COVID cases and the necessary protective equipment needed to go inside.
Excuse me, Christine, I gotta get right in here.
She's layered in armor, an N95 mask, a surgical mask, a face shield, a gown, 2 pairs of gloves.
Do you feel you have enough?
Right now, yes. Right now I do. We can kind of feel things are getting a little bit tighter.
15 of 19 patients on this floor are COVID positive. There are another 16 COVID positive patients on another floor. We're told there's an uptick in COVID hospitalizations here at Suburban, including some from nursing homes.
We're seeing the gamut. It doesn't really matter. We may have a higher number of older patients or patients with pre-existing conditions, but we're seeing everything.
Did you ever think that we would be in a situation like this?
I didn't think it was going to get this bad.
While confirmed cases continue to climb in Erie County, these medical professionals are rising to the occasion. What we do right now will impact what happens in the future, stopping the spread and saving lives. You'll see the emotional impact this crisis is having on these folks in part 2 of my special report, Inside the ICU, tonight at 6. And Katie, it was such an honor to be inside the ICU, speaking with these first responders and these people on the front lines. They are working so hard and doing all they can to save these people.
Yeah, absolutely. We appreciate every single thing they're doing. We know every minute of their day is just so vital. Ed, thank you.